It is said, he who has health has hope, and he who has hope has everything. Very good evening, viewers. Welcome to BMC Global Live AL-HILAL Health World, an exclusive health talk. Myself, Marina Francis. Today's episode is a continuation of last week's episode in which we discussed about various aspects regarding a child's health and well-being. Definitely, this Health World episode would be a step forward in the journey of our children's health, of our nation's future, in fact. Almost all of us, many of us, we keep hearing from our parents, we keep hearing from adults that the older generations or the generations before us, they were more healthier, they had lesser health problems, they lived longer, and many things like that. These are statements that keep irritating us, that keep troubling us. Definitely, the changing lifestyles have a major role in contributing into such diseases in the young generation today. So definitely encouraging children, even with these restrictions, encouraging children to live a healthy lifestyle should always be taken seriously by us. And today we have a very apt person to talk to us on a child's health. Let me welcome Dr. Abuzer Surka.
Hello, good evening.
Good evening,
How are
doctor.
you?
A consultant pediatrician with over 27 years of experience. He is here to answer most of our queries regarding a child's health. He has completed MBBS and MD in pediatrics from Gujarat University, has an expertise in treating allergies, neonatal problems, nutritional problems, respiratory problems, birth defects, newborn screening, etc. He has participated in international conferences like Nutrition and Growth, ESFGAN in Europe, United Kingdom, and many other countries. He is currently working at AL-HILAL Hospital. He will be available in Muharraq branch. Definitely, we are very privileged to have doctor with us today. So let us continue with the questions from our viewers regarding child health. Good evening, doctor.
Good evening. How
Once
are you?
again-
My also privilege to share my experiences with you and your viewers. So
Thank
nice
you,
of you to
doctor.
invite me.
Once again, we are very happy that you came back in our episode today.
My pleasure always. Thank
Yes,
you.
doctor. Doctor, last week we dealt with allergy aspects
Yes.
and child health during COVID times.
Yes.
So this time also we have questions from our viewers, actually more than last time. So let me move on to the first question.
Yes.
Let us start from the smallest age group. So regarding newborn, the first
Yes.
question is regarding newborn. The question says like this: my newborn baby cries a lot, especially at night. And being first time parents, we don't understand how to comfort her. So please advise.
This is a very common problem in newborn babies. In medical terms, we call it also evening colic.
Okay.
You know, this is a sort of gaseous problem, colic problem, which more often happens in the late evening and night, and it usually happens in kids who are after feeding. We don't do the burping very frequently, or we don't do it completely.
Okay.
Sometimes there may be some mild digestion issues in the newborn baby. We don't need any particular medications,
Okay.
and only if it is very severe, persistent, and is affecting the child's overall health, we need to consult a doctor. So what you will do at home? You know, at home I always advise the parents of the newborn babies that after the feeding is complete, try to burp your baby for at least 15 to 20 minutes.
Okay.
15 to 20 minutes, because you know, most common mistake that mothers do is that once they hear the burp sound, which comes after 5 minutes or so, they make the baby lie down. So try to burp as much as possible, so for about an average period of 15 minutes to 20 minutes. This will help to aid the digestion of the baby and help the baby to be sort of, get herself, relieved from the gas, and there will be less problem of colic and crying at night.
Okay.
Secondly, things the mothers sometimes overlook, because the baby is crying at night and the mother is also sleepy. We tend to overlook that we need to check the diapers of the baby also. It's a very common problem. Sometimes it comes in the emergency. It becomes very funny too, because the only problem is the child is a wet diaper and the baby is crying. We don't need to do anything else except change the diaper.
Okay.
Coming to the more serious part of it, if it is very much persistent, then the baby needs to be evaluated. Maybe it is a first sign of cow's milk allergy. The child is not able to tolerate the milk,
Okay.
and hence the baby may be having persistent colic, persistent crying. Then it needs proper medications and proper investigations.
Yes, doctor. You would have answered the doubts of many first parents out there. Doctor, what are the screening tests generally do for newborn babies?
See, there are certain protocols which vary from country to country depending upon the most common neonatal newborn diseases which are prevalent in the country. As far as Kingdom of Bahrain is concerned, all babies, mostly all babies which are delivered in the government hospitals and also private hospitals, they undergo stringent newborn screening for the basic blood disorders which are common over here, like sickle cell anemia and thalassemia. This is a basic screening test which are being done. Apart from that, if there is any maternal history of thyroid disorders like thyroid problems in the mother, then the baby needs to be screened for hypothyroidism. Then there are certain congenital anomalies, certain defects, certain sort of which we call as neonatal metabolic disorders or metabolic disorders of the newborn. This may warrant some screening only if there is a strong family history in another sibling or any other member in the mother or father's family, because these sort of disorders are hereditary and we need to catch them as early as possible, and that's why we may need some screening. These are for example phenylketonuria, and there are certain glycogen storage disorders. This all can be screened in the newborn period, but this all depends upon the case by case, and we don't do it in all the babies, only those who require that.
Okay. Doctor, another common term that I've heard is newborn jaundice. It is quite common,
Yes.
I think.
Yes.
Can you throw a light on that?
Of course. See, nowadays also newborn jaundice is a very, very common problem which comes to our clinical practice. Now, regarding neonatal jaundice, which we call in medical terms, neonatal means newborn. So, it is categorized into two basic parts, like it is physiological or pathological. Physiological means it is a normal jaundice, it is a normal exaggerated jaundice. But before going into that, I would first like to clarify very important point, that jaundice in the newborns is very different from the jaundice which we see in the older children or in adults. The jaundice which is seen in the newborn is purely in the blood group, or it is due to another causes due to which the serum bilirubin rises. It is not due to any sort of infection. It is due to the excessive hemolysis of the red blood cells, either due to difference in the blood group of the mother and the baby, or due to many other causes, the red blood cell disorder and so on. But the jaundice which we are seeing in older children or in adults, that is an infective jaundice which is caused by a virus. It is called hepatitis virus, which are again of 4 different types. We don't want to go into detail of that jaundice, but always parents should remember that jaundice in newborn is totally a very much different thing than the jaundice seen in the adults and older children. Now coming to the newborn jaundice, so what do we do now? So there are certain guidelines. There is the American Academy of Pediatrics have given a very good flow chart, a very good graph, which we follow the world over. All pediatricians we follow that. According to that guideline given by the American Academy of Pediatrics, we categorize the child. First, we check the bilirubin level. The first and foremost thing, because there is no other way we can diagnose how severe is the jaundice. So when a baby comes to us in the clinic, or when the baby is admitted in the ward and we go for rounds and we find that the baby is yellow, first and foremost thing we need to do is check the bilirubin of the child. Then depending upon the level of the bilirubin, we have to categorize whether the child requires any further treatment like phototherapy or to keep in the newborn ICU, or it is a physiological jaundice. If it is physiological, it doesn't require any further treatment. So there are certain graphs, certain levels which we follow, and if the child, and this level depend upon the age of the child. So depending upon the level of the bilirubin, and that level is plotted against the age of the child, and which in hours, usually in 24 hours, 48 hours, like that, and then we get the mark where the child requires phototherapy or not. Around 90% of the cases, roughly, they are usually physiological jaundice. They don't require any further treatment. So we don't need to worry. Only thing is you can keep the child in the early morning sunlight, so that it helps the bilirubin to pass out faster. A child has got bilirubin, how will it become normal if it is high bilirubin, if it is jaundice? So the bilirubin is a pigment which is washed out from the body in the urine and the stool of the child. So best thing for you is to, if it is in the physiological range, the parent should follow the doctor's advice, who will usually advise them to keep at home, keep in the early morning sunlight, and follow up every 48 hours. If in between you find any symptoms which are sort of signaling us towards the worsening of the baby's health, which symptoms like vomiting, poor feeding, child is excessively crying, or in the worst case, child is having some seizures or fits. If these things happen, then immediately consult a doctor, again go. If there are no such symptoms, because these symptoms are not common, hardly they happen in 1 or 2% of the cases. Child is feeding well, passing stool and urine properly, just keep in the sunlight, and every 48 hours consult a doctor, and within 4 to 5 days the jaundice will go away. If it is pathological jaundice, then what is pathological? Pathological means there is some disease because of what a jaundice has happened. In that case, jaundice level will be very high. It will be like very high above the normal range. Certain ranges, like it may be 15 milligram or so. Normal is less than 1 milligram, but it may be very high. So in that case, the doctor will try to first find out the cause of the jaundice, whether there is some blood disease, whether the blood group is different from the baby and the mother, or whether there is some red blood cells abnormality why the jaundice is so high. And simultaneously, we will start the treatment for the jaundice, which is phototherapy. But this all is done following the American academic guidelines. Nobody should deviate from these guidelines, because these are accepted internationally, and this is in the well-being of the newborn baby. So you should not worry. Most of the time it is physiological, but don't keep at home and don't neglect it also. At least take a doctor's advice who will advise you properly.
Doctor, let's take up another question from one of our viewers.
Yeah.
The question says, my 6-month-old baby has frequent episodes of gas, constipation and vomiting. So the question is, do I need to change the milk?
See, immediately changing the milk is not the solution. We can try with that, but we need to find out the cause if it is persistent.
Okay.
If it is persistent, like vomiting, constipation, then we have to think of the causes, why the child is having this thing. So there are several causes. Very common causes are, again, it is cow's milk protein allergy. Allergy is the most common cause. Secondly, there may be some congenital birth defects in the gut or the stomach and the intestine of the child.
Okay.
Because of that, the child may be having these problems of digestion. The child may not be able to feed properly, or after feeding may be vomiting every time.
Okay.
So we need to evaluate. We need to do certain tests, maybe some ultrasound of the abdomen. Maybe there is some lump inside, or any other problem. There can be so many problems, which though they are very rare. But we need to also we need to be sure that these conditions are not present, because we have to first treat the treatable cause. That is how a doctor goes about. So first find the cause which can be treated.
Okay.
Otherwise, if we are just changing the milk, and if there is some another cause to that problem will not be solved, and you may be more confused. Doctor will evaluate, examine the child, and then decide the child needs further test, or we need to simply change the milk and we can give a trial.
Okay.
So I think it is better for the newborn babies, especially the parents should not make the decision themselves, because the newborn baby is not able to tell his or her complaints properly. There is always a very good and very well experienced pediatrician who can tell you that what problem the baby can have.
Yes.
And if required, only we conduct certain tests, and then we solve the problem of the baby, and then all is fine.
Yes, doctor. I feel that answer would have clarified the doubt of the viewer that asked.
Yeah.
The next question is, could you please shed some light on what would be the most healthy choices of food for children from 6 months up to 6 years? How the nutrition should
Yeah,
take
this
place.
is a very, very common confusion in the minds of the parents. Although nowadays we have got everything available on the internet also. But as from a pediatrician's point of view, my advice is that 6 months to 6 years, these are very different age groups, and all have their own requirements for growth.
Yes.
So, initial years from 6 months to 2 years of age, what the child requires, child is growing fast. So, it requires more amount of calcium, iron and protein.
Okay.
Iron is required for the good health of the red blood cells and the hemoglobin, which will help the child to stay healthy. And will also ensure the good appetite of the child, because if the iron is low, the child will have low appetite, and this will again compound the problem. Good level of proteins are required for the health of the muscles and the overall increase in the height and weight of the child. Okay. And last comes the calcium and vitamin D3, which are required for the good health of the bones and the teeth. Teeth is very important thing to consider in this age, because it is a time when the maximum teething occurs from 6 months to 2 years. So, we have to ensure that these things are obviously present in the food of the child. So, from 6 months to at least 1.5 years, when the child is not able to chew properly, the food should contain liquids and semi-solids. Okay. But you can give all the nutrients. For example, if you want to give iron, you can. There are so many options available the green leafy vegetables are there: beetroots, dates, jaggery. These are to name a few. This contain a very good amount of iron, and this you can incorporate in the child's food by in the way of soups, liquid or semi-solid items, and you can ensure that the child gets the daily requirement of the iron. Coming to calcium and vitamin D. Calcium is more present in milk, as we all know. Also, it is in milk dairy products like cheese, also in certain vegetable soup like drumsticks, and also calcium can be present in certain non-vegetarian items like soups of the bones and this are different type of liquids. So you have to ensure a child gets adequate amount. And here I want to stress one very important point and very common mistake the parents make is, especially in this nowadays the fast age when the mother is also working, they mostly rely on the packaged foods. Please don't do that. My advice, sincere advice as an experienced pediatrician, because what you are doing is you are not letting the child develop a taste. This is a commonest mistake. The packaged food, more or less, even the different formulations, they almost taste the same. They are all having, another thing is they have chemicals and preservatives. Although we are not against anything, but this will be required only in certain conditions. Most of the time, ensure the child gets natural food, and ensure the child after 6 months of age gets all different types of taste like salt, salty, sweet things, sometimes something spicy, something bitter. Because the child, this age is, there are two advantages. If the child is under your control, what you will say, the child will do. Remember this. Once the child grows up, it is very difficult to handle a child. You cannot force a child. But a small baby, you can, because he is still not exposed to any other taste. Child will develop. And another very important thing about human behavior, human psychology, the taste is always acquired. Taste needs to develop. A new taste, don't get upset. Your child is not taking something salty or not taking something spicy. Then don't get upset that my child is not taking. Just persistent. Just be persistent. Persist with the child for 2-3 days, two or 3 days with the same item. Don't change the food category frequently.
Okay.
Persist with that. Child will obviously take. Let the child be hungry. Human behavior, we know human psychology. When we are hungry, we are ready to eat anything.
Yes.
So always same way it goes with the child. Let the child be hungry. Don't give it to the child's tantrums. Commonly, I see nowadays parents are so much the protective of their child that they just give into the tantrums very easily. And the child, nowadays the kids also are very smart. They understand that you are giving to the tantrums, they will do it more. And ultimately, who is the loser? The child. Child is a loser. Child is not getting the complete nutrients. And these same children who are kept on packaged foods, most commonly after 2 years of age, they become fuss eaters because they have not developed taste. They didn't know how is the taste. Spicy food, how is salty food. They only know one particular taste, and they are only happy with that. So always I would request all parents and mothers, take some time out for the child, give some time and prepare and sit with the child. And again, even from 6 months age group to any age afterwards, make eating a happy experience for the child. Make it a pleasurable experience. According to the age, you have to behave with the child. But always, the children are very, very, very good. We are very, innocent. They will, but you have to be with them. You have to be one with them. That's the only way you can handle them. Don't force them. Never, in any age group, from 6 months to 6 years and even beyond that. Although beyond that is less possible, but 6 months to 6 years, your lunch time or dinner time are very happy time for the children. Then only you will get to see the proper growth in the children. Otherwise, any person, even you yourself, when you are not happy and are doing some work, you will not get whatever you want the results, you will not get it, because results always depends upon the happiness also. So just do that, and the food items, as I told you, concentrate more on calcium, iron, and protein food items. Which are the list of items you can easily find on the net. I just named a few of the items. Incorporate them. Like when the child starts chewing after 2 years of age and is also eating solids, you can find, for the Indian viewers, I'm saying, you can make some parathas and something which contains green leafy vegetables, which contain beetroot. You can even make some paneer, tofu. These are very healthy items. Soya chunks, soya granules. These all contain very good amount of protein and very healthy. And give all type of food. If you are not you're eating also eggs and non-veg, give eggs, non-veg, everything you can start. One by one start, because all food items is specific in its own way. They all contain the nutrition. But most important thing is the child should be interested in eating, child should be happy while eating, and should, after a certain age, like after 2 years of age, child should learn to eat on its own. Then he gets the satisfaction. right? So more important, my answer would be not particular food items. I will not name them. That you can find on internet. But my tips will be from my experience of so many years, how to feed, how to give the food, and how you can make it happier for the child, and how you want to ensure that your child grows up very healthy. So these are the tips. Okay. So just try to be. I would again just request all parents that never fight with your child during the eating hours, which most commonly happens, and the child will next time he has in his mind, he has in the psychology that again this now bad time is coming, like in the when you were in school you didn't like one particular subject, and when that period comes you always want to avoid it.
True.
So it's the same way here,
Same here.
right? So that's my advice.
Yes, yes. That was a very important takeaway for all parents and caregivers out there. Food time should be a happy time for the children. Definitely, we have more questions to come. We have covered only the younger age group category till now. We shall be back after a very short break at Health World. Stay tuned. Welcome back. You're watching BMC Global Live AL-HILAL Health World. Here we are discussing on the topic a child's health, and definitely we have got many questions from the viewers. We have taken the repeatedly asked questions. So let us continue with the rest of the questions. So doctor, the next question is regarding junk food and obesity, weight gain. So my child is almost addicted to junk food. How can I convince him to have healthy food? He's obese also. Doctor, you mentioned about how to feed children.
Yes.
But regarding obesity or weight gain, how can we address that?
Yeah, see, this is very commonly seen in the Gulf countries. I've observed because of the food habits of the child. They are mostly addicted to the fast food and junk food like burgers, chips, fries, and pizzas. See, they are not all bad always, but when you take it in excess, it is going to harm the child's health. How it harms, it sometimes adds up to the cholesterol and the fats in the body. It also contains lot of preservatives. So it is not good to give this. So why first as a doctor and as a parent, I would like to ask one question. We need to ask ourselves also, why the child is addicted to this food? What is the reason? So answer comes is because of the advertising first of all. They got a very good advertising. Secondly, the child likes that presentation. So what we can do as parents, what you can do? So you can present the food in that same manner that they are giving in the fast food chains.
True.
But with the healthier ingredients, freshly made at home, not the frozen types. Frozen ones, obviously we all know that frozen food has to contain the chemicals and preservatives. Otherwise it cannot survive for a longer time. Why to give something which is so much like not fresh? We should always prefer the fresh food for our children. So mothers can take out some time and they make the fresh food in the manner which the child likes. And children are very much, their mind is always wavering. They like something new always.
Yes.
Even if we experience with toys, you bring a new very good toy, after 1 month the child will be bored of it. Same goes with the food. You have to present the food, the same thing. For example, you are giving vegetables. You have to change the presentation. You make sometimes burgers, make sometimes parathas, make sometimes Frankies, whatever you like, But you have to change the presentation. You have to make it more presentable and more. The child will get attracted to the food. You have to attract the child. That is very important. So make it colorful. Add some colored vegetables. Again, I always believe that nature has got everything. So we have to pick it up from nature, and we have to present it that the child gets more inclined towards our healthier food than the junk food. Because in the long run, the junk food is not going to help the child at all.
True.
So this is my tip, one way. Secondly, whenever you prepare the food, homemade food, always keep in mind the ingredients, what is going in there and what is the value of that. Nutritional value regarding the protein, iron, these different types of vitamins, calcium, and according to the age. So from the 2 to 5 years of age, the child is growing fast. So we need to keep more of protein, calcium, iron in that. As the child grows up, the iron part can become less, but we need to put more of protein, other multivitamins. But the food presentation is a very important part. We should please the eye and we should please the tongue. These two things, and you don't need to worry about. Then the child will come on his own will come to you and tell you that I want food, give me some food.
Yes, that was definitely a very interesting point again. We might sometimes tend to forget that it should be pleasing to the eye. Food
Yes.
not only healthy, but not force feeding healthy food, but it should be pleasing to the eye.
Yeah,
Only
you know
then
how is
should-
a human mind always like to see good things.
Yes,
So same goes with the food. We need to see the food should be so nice, attractive, colorful. For kids, make it colorful.
that
We
is
have
true.
got so many natural colors,
Yes.
and then make it the way he likes. Don't force something he doesn't like. And if you want to give something different, first of all, give something along with that. Give something he likes, and then put some new item,
Yes.
which he is not used to, but you have to make him used to. So that way, you have to first gain the trust of the child.
Yes.
It's very important. The trust value is very important in a child-parent relationship, and it begins at a very, very early age.
True.
So we need to keep that in mind, especially mothers. They are tired with other work, maybe other children, or so many other things, and they have their own jobs. So I would, at this juncture, also request that as a family, everybody needs to get into it, and we need to help each other, and we need to keep the well-being of the child in mind. Give healthy. Don't let the child go towards junk food. That's the bottom line. You are also worried as a parent. Same way as a doctor, I would also advise. But you can give all types of healthy food in all types of pleasing manners, and just keep that your goal in life. It will be good.
True. Doctor, I think another similar question, on similar lines, there was a question. My son, 7 years, is very fussy in eating and likes more junk food. But the question here is not about gaining weight, it is that he does not gain weight. So that is another trouble. How can I give him healthy food? Again, the same
See
question.
this. Why is the reason? Why there are two different scenarios. One child is obese, one is
Yes.
not, one is underweight. As I told you, that junk food doesn't. This actually proves our point that junk food doesn't contain all the necessary nutrients. So sometimes the body may react in a different manner. The child may not gain weight because the child may be having some deficiencies. The child is not putting on weight,
Okay.
right? So it is very important that we keep the nutrition value of the food in mind. That is the most common thing many people forget while preparing the food. The nutrition value of food, and it is very easy nowadays because of the internet and Google. You can easily find out which food item contains how much nutrition.
True.
And as far as Indian foods go, we have got so many good foods like pulses are there, and vegetables, and so many things, and you can easily incorporate that in the food for the child, and the child will also gain weight. The same child will become normal in weight, and maybe he is not having sufficient appetite. Maybe the child is having iron deficiency. So if it is actually a problem if the child is eating well and still underweight, then we may need to do some test. But first of all, we ensure that the child eats a wholly balanced diet. That is very important.
True. Doctor, the next question is regarding teenage category. My teenage daughter complains of frequent headaches. Please advise what to do. Headaches, how seriously should we take headaches in
this
children?
is a very,
That
very
is-
good question. Headaches in children, especially in teenage, they are due to many reasons.
Yes.
But majority, first we have to rule out the psychological conditions. But before going to psychological part, we need to find out there is no other serious disease.
Okay.
So the headache, as a doctor, a pediatrician, usually takes a proper history that in which part of the head the headache is. It is in the front part, it is in the back part, in the sides. This all matters. Secondly, is there any other associated problems like eye problems? The child is not able to see clearly. The child is getting tired frequently. The child is getting vomiting. These are the common symptoms I have
Okay.
told you. So let us see one by one. Like if the child has some eye problems, obviously the headache could be due to the errors of refraction. Maybe the child needs glasses. So you go to an ophthalmologist, get the eyes checked, and then go ahead. If the child is having vomiting or any other social symptom like weight loss, not eating properly, along with headache, it may be pointing to a serious condition. So go to a neurologist or go to a pediatrician. Pediatrician will examine the child, all the parameters, vitals, certain tests may be required to rule out certain rare diseases, but which may be serious.
Yes.
There are many others. So we need to evaluate that, and we need to be sure that the child is not suffering from any such disease. Then very common part is the child may be getting tired easily, especially in girls, as we have this view. So what could be the problem? No? The child is getting tired and headache. It is very common problem, but very commonly missed also. From certain studies and research, it has been found out that iron deficiency also can cause headache. which is a much less common symptom, but it does happen.
Okay.
And I have seen just such patients, and after starting iron therapy, the headache vanishes like anything.
Okay.
So it is very important to note this thing, that if your girl is there at around 15 years of age, maybe she is having the menses also, and she is losing some blood, and she is also not eating well, she is having iron deficiency. We need to check that. And then once, it's the simple thing, we need to add the iron to a diet, and to maybe give some iron, I mean this iron syrup or tablets, if it is iron deficient. So the headache will go away. So just simply giving some painkillers for headache is not the solution.
Not the solution.
Don't do that, because headache is a symptom which needs to be evaluated. It needs to be, properly investigated to know the cause of the headache. Headache is an sort of presentation. Something is going on inside. So we need to find it, and then you can solve the problem.
Yes. Doctor, next question asks to give some advice on how to manage hair fall in young girls.
See, hair fall, as we all know, very common, is also one of the symptoms of vitamin D deficiency.
Okay.
That many may not be knowing about it. So vitamin D deficiency also is very common in the Gulf states, as we are told before, because of the less exposure to the sunlight. So if the hair fall is really persistent and too much troubling, even after changing the water or putting water filters, we are not able to solve the problem. At least get the child evaluated for the vitamin D. If it is found to be less, and sometimes vitamin D supplements can help in solving this problem.
Okay. That was a good tip, because most of us didn't know that hair fall was related to vitamin D.
It is very frequently.
Doctor, another question regarding the children of bigger age category. While a child is attaining puberty, what are the common problems that children face, and how to address those? Can you mention in general?
Very nice. See, pubertal age is a very, a critical age for a child, you know. So there are two types of problems they can encounter. One is a psychological problem, one is a physical problems. At this age, the child's behavior changes drastically.
True.
The child's interest changes drastically, and the child's own body changes drastically. So as a parent, first and foremost, as a parent, you need to be very much cooperative with the child. You need to be understanding, and you need to understand the problems the child is facing. Okay, so don't get angry with the child, because they will get more angrier to you, because it is this age. The hormones are changing, hormone levels are changing.
True.
So just be patient with the child, and just become like a friend for the child, and just lend a ear to the child's problem. Listen to the child, what he or she is feeling. And most of the problems are like temporary. They are not permanent. There will be hormone changes. A child may not be, sort of feeling shy sometimes because of body changes. In boys, the hair growth. In girls, the growth of the breast. And there will be also the growth of the body. So all these things, the child may sometimes feel awkward. So as a parent, you need to understand the child. You need to reassure the child. And you need to stay with the child whenever the child needs you. Do not avoid the child, or do not avoid talking certain taboo topics. As a parent, it is a duty, because nowadays, especially in this world of internet, if you don't talk, or if you don't listen to the child will go to somebody else. And someone else, you don't know how much so reliable that source is, and whom your child is trusting. So is it not better that a child trusts you rather than trust somebody else?
True.
So this is very, very frequently I feel that parents themselves feel shy about talking. Don't do that. It is not something, this is from nature. This is a part of your growth, part of your life. So why should be shy about it? Talk with your child, be frank with your child at this age, and listen to their problems. And if you feel that problem is really serious, or something that needs to be given proper attention to, consult a pediatrician, and he is the best person to guide you.
Yes, doctor. Doctor, another something that disturbs children. In the same class, there may be some children who grew up faster than the others in terms of height or the signs of puberty. So it is always a trouble in those age categories. So how can we make the children understand?
No, your question last was wrong. You make the parents understand, not the children.
That is true.
Because this is very common thing we face, that the parents immediately begin comparing with the cousins, with the peers in the class, and with the neighbors' children. See, one thing we should understand: God has made all of us different. We cannot be all clones of each other.
True.
And we cannot all grow at the same pace. If there is a real serious problem, you are too much worried, too much anxious about the child's growth, you can always consult your pediatrician. A pediatrician will check the child, examine the child. If required, he may advise certain tests. It's not always the problem, All child has their own pace of growth. Some may grow faster, some may grow slowly. There are also many other factors associated with that. Maybe sometimes it happens one of the parents is short stature, the child may be short stature. This is absolutely normal, learn to accept that.
True.
Why we should be ashamed about of our body shape and size? We are all different in our own way and we are all normal. There should be no need to do that. And as a parent, you should always support your child. Don't let the child feel ashamed and don't compare. You see that XYZ son is this much kg and is so much tall, and then you are not eating well, you are not growing. No, it's not like that.
Yes.
Don't do that. Don't ever bring your child down in front of others and all these things. Never do that. Because this is a part of life. This may be normal, absolutely normal. Sometimes the children may catch up growth when they're near to the puberty, around 16, 17 years of age. Sometimes they may be as they are. But if you are too much worried, okay, one time just do a complete checkup evaluation. And if in that evaluation you find some problem, we can treat it, obviously. But if there is no problem, then don't further bother the child.
True.
Let the child grow happily.
Yes, doctor. That was a very important reminder for all the teenage viewers and also their parents, importantly, out there.
Yes.
Doctor, during the younger age, maybe probably up to 6 years or 7 years, children keep getting cold, fever on and off. And even some children, even in their teenage years, they keep getting. So in these restricted times, COVID times, it is difficult to always seek help from a pediatrician or go to a hospital. So it is always a fear in the minds of parents when the child gets a small cold, should I run to the hospital or not? How would you address that or some advice?
This is, especially in the COVID and pandemic times, even a single cough sets off the alarm.
Yes.
So if you know that your child is having this problem since a long time and frequent cough and cold, then be assured the child is simply having allergy. Because only cough and cold is not a symptom of COVID, and sometimes COVID cases may be having no symptoms. So don't always relate a cough and cold to COVID. But if there is any contact in the house or anything, there are other factors, then it's okay. Otherwise, it's simple cough and cold, and you just are worried about it, and you cannot go to the hospital. Either you go through telemedicine there. So if you want to consult a doctor, we have got also in AL-HILAL Muharraq, we can consult by phone. Okay. Secondly, what we can do is that you can just wait for 2-3 days. It may be simple, normal, allergic cough and cold. It may go away. Yes. If the child was previously on some anti-allergic medications, try to contact your doctor who was treating previously, and just tell the symptoms. Don't do much self-medication. Simple cough and cold, occasional cough and cold usually goes away. Yes. You don't need to do anything. But if it is persistent and if you are really too much worried, then better consult a doctor rather than rushing to any sort of conclusions. Yes. So you can either consult doctor by telemedicine, or you can go in person and meet the pediatrician.
Yes, doctor. Doctor, you mentioned many aspects here. Everything was put up together. Yes. So at last, what would be your takeaway message that definitely viewers should remember?
See, today we talked mainly about the food and nutrition and about the newborn babies. So regarding food and nutrition, the takeaway message is try to give a full balanced diet to the children. Yes. Keep the diet palatable, presentable, and pleasing. The 3 P's you should remember. Palatable means the taste should be very much appealing to the child. Presentation, add some colors, add some different forms and shapes and size. You have to be creative in short. Yes. And last is that the food should be healthy, should contain all sort of nutrition. Sure. And make it a happy time for lunch and dinner for the children. Then we talk about the newborn babies. Newborn babies, how they are screened. What is newborn jaundice? We don't need to worry in all cases of jaundice. Most of them are normal or physiological. And certain screening tests which we are doing in HILAL as and when required. So that was the main takeaway. And lastly, we also talk about the psychological aspects of COVID and how it affects the child. And also when the child reaches the age of puberty, what you do. So these 2 things, the parents have to be very much compassionate, have to be very much patient with the child, have to loving and care, and they have to understand the child's psychology problem. Yes. Do not ever quarrel or fight with the child. The child trusts you, and don't lose the trust of the child, in short.
True. Thank you so much, Doctor. You joined with us in 2 episodes and answered all our queries and answered more than that actually, Doctor. Thank you very much.
Thank you. My pleasure always.
Definitely these 2 episodes regarding child health would have been surely helpful for all parents and caregivers out there. We shall be back next week as well, same day, same time with another topic. And Oscar Wilde has once said, to make a child good, the best way is to make the child happy. So let's keep that in mind. Keep smiling, keep spreading happiness. Good night.